Okay, I am going to demonstrate NG tube insertion and gastric lavage and gavage. My safety practices are I will check my doctor's order, then I'll do hand hygiene before and after patient care. I'll check the facility procedures, check the manufacturer's recommendations. I'll knock on the patient's door, identify using two identifiers, note their overall condition, draw the curtain and explain the procedure. I'll put on the appropriate PPE, and I'll raise the bed for good working conditions. When patient care is done, I'll lower the bed, give the call light. Then I will make sure instructor is present for every push, and then I'll document. Okay. And we are giving Gusana, so the med rights are the right patient gets the right medication, right dose, right route, right time, right indication, right documentation. Okay, so again, glove. I'll do a focused abdominal assessment before beginning, and then I'll position them semi-high fowlers. And we'll check nares for patency. We're going to use the left nare. So then I'll get my tube for measurement. From the nose, the ear, to the xiphoid. And you want to mark that with tape or marker. And then I'll go ahead and lubricate the tube for 3 to 4 inches. And then we can insert. So you want to make sure the patient's head is tilted back. Insert. And once it's at the back of the throat, you'll want to chin tuck. And then if there's any coughing or vomiting, you'll want to pause, pull back slightly. You can offer some water. And then wait till it subsides, and then continue to advance. You'll go to the pre-marked position, and then temporarily secure it. And then we'll get a chest x-ray to confirm placement. Once it's confirmed, we'll go ahead and secure it more. And then we'll have him turn his head left to right. And then we'll pin it to the gown. The rubber band is everything. And then we have an order to attach to low end suctioning. We will attach. And then make sure he's comfortable, and then we'll document which nair was used, the size of the tube, how they tolerated, and how the placement was confirmed. And then now we have an order for lavage. So we'll come in Position the patient in semi to high fowlers, and he'll be on his left side. And then we'll check placement with an x-ray. Once that's been checked, then we can go ahead with the lavage. Isolation. Some clamp. Still my solution. Still a solution. And pull back the signal out. And assess. And you'll want to do that until contents run clear or light pink, 3 o'clock. And then the clamp. And document how it was tolerated, the amount, consistency, the color of the residual. Okay, and now we have an order to administer Glucerna. So we'll come in, check on our patient, position on semi to high fowlers, check the tube placement with an x-ray. It's in the right spot, so I'm gonna check my Glucerna, make sure it's not expired, the sediment container's okay. So now I will assess the residual. So I'm gonna clamp. And I'll pull back. Contents. Put it in my images. And then if it is less than 150, then we can give the feeding. So it's less than 150. Let's go ahead and take some syringe. I'm going to flush with 25 milliliters of water. Let that run, and you'll want to hold it 18 inches above the insertion site. Once it gets low, the clamp, wipe the container, pour it in, let it run until it gets low. Clamp it. Put in the other 25 milliliters. And let that run. Once it's done, we'll clamp it. And clamp our tube. And then we'll document how the patient tolerated the residual amount, consistency of that, and the type of feeding that was used. And flush them out.